With a growing aging population, some areas around the country are experiencing doctor shortages, and smaller communities are hit especially hard. Only 11% of physicians have rural practices.
In Health Watch, Shelley Botat tells us about one program that's designed to attract future doctors to those communities.
The goal of the Wisconsin Academy for Rural Medicine, or WARM, is to increase the number of doctors practicing in rural areas of the state. It is an education program within the UW School of Medicine and Public Health. And Aurora BayCare Medical Center is one of 3 extension campuses helping train future doctors. As a medical student in clinicals, Hope Villiard is learning a lot in the emergency department at Aurora BayCare Medical Center.
If there's traumas that come in, they've been letting me try to run the traumas. I can sew up lacerations.
Hope always wanted to work in the medical field.
I want to do small town community medicine and just build those relationships with my patients.
Which is why she joined the WARM program.
Educating medical students in their clinical years in rural settings with the hope of increasing the number of physicians practicing in rural areas in Wisconsin.
Dr. J. Richard Ludgen is the Director of Medical Education at Aurora BayCare. He says WARM students spend their first 2 years at UW-Madison completing their in-class curriculum. Then they complete their clinical training in rural learning hospitals.
Let's give students the actual experience of what it feels like to practice, first of all, in Wisconsin and not in a big city.
So when they become doctors, they choose to practice in rural communities.
While they were here, they developed relationships with many of our medical practices. They've stayed in touch over the years, and we think eventually this will be a route for our being able to regenerate the staff that works at ABMC.
Hope says the program has given her a more hands-on education.
I have physicians here who I work with one-on-one every day. In surgery in particular, which is what I decided to go into, in the operating room, I was working one-on-one with a surgeon, and that doesn't happen at bigger hospitals.
Hope is currently interviewing for a general surgery residency. After that, she hopes to end up back in Wisconsin.
My ultimate goal is to be a small-town bread and butter general surgeon.
The UW School of Medicine and Wisconsin Medical Alumni Association are holding an event at Lambeau Field on the WARM program. Hope is one of the speakers. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.
Thank you, Shelley. A new tool to identify and treat muscle and joint injuries is helping patients get back on track. That story tomorrow in Health Watch.